What does the number 366 million mean to you? Well, likely you need to know what that number represents to answer that question truthfully. That number represents the total projected number of persons around the world who will develop diabetes by the year 2030, only 10 years from now, according to the World Health Organization. So, what does that number mean to you? You may have relatives, friends, family, and yes, even yourself who will be a part of that number. Yet, the global impact of diabetes, what causes it, and how to control it are subjects that you are no doubt familiar with. So, why have me and my classmates film this video for you today? Well, we wanted to film this video to discuss areas of diabetes with you that you may not have thought about before. My name is Breannah Galvan, and later in our video, you'll be introduced to my classmates, Shelby, McLaury, and Lorena, Avina. We're second-year students at Del Mar College's Dental Hygiene program. And today, we would like to discuss with you a few different areas of oral health care that are of concern for people with diabetes, such as the relationship between diabetes and tooth decay, the possibility of developing oral fungal infections, the relationship between periodontal disease and diabetes, the effects of diabetic medications on the oral cavity, and how to properly care for and maintain your teeth. First, we're going to start by discussing periodontal disease and its damaging effects. Periodontal disease is a broad term used to describe different diseases that can develop in the oral cavity, such as gingivitis and periodontitis. Gingivitis is an inflammatory response of the gingival tissues, or your gums, because of an accumulation of plaque. Plaque is also known as dental biofilm, and it's the soft, mushy material that is made up of different types of bacteria. When plaque is allowed to remain on the teeth, this causes the body to send inflammatory cells to fight the bacteria. And this could cause a change in the color of your gums, in the texture, and even how they look. And if you notice our pictures on our slides here today, where the arrows are pointing at the margins, they're more inflamed, they're redder than the normal pink color they should be, and we can even see some of that plaque on our teeth. Thankfully, though, gingivitis is reversible and can be remedied by good oral hygiene. There is no permanent damage done. However, if plaque remains, the body continues to work hard to fight the growing amount of plaque, and this could lead to the development of periodontitis. So what is periodontitis? Periodontitis is an inflammation in the periodontium, which would affect the gingiva, or your gums, ligaments that support your teeth, cementum, which is a thin mineralized tissue on tooth roots, and alveolar bone that supports your teeth. However, this definition can be misleading by only mentioning inflammation, and it sounds very similar to gingivitis, when in actuality, periodontitis has an irreversible effect on the oral cavity. Periodontitis has its start, just like gingivitis does, with the accumulation of plaque. As the plaque remains on the teeth and gums, the body starts the inflammatory response to get rid of all that bacteria. When the plaque is disturbed and removed by good daily oral hygiene, the body stops this response and no damage is done, like in gingivitis. However, when plaque is allowed to accumulate over a period of time with no disturbances from brushing and flossing, this is when problems start to occur. As inflammation cells continue to flood the tissues around the teeth, there is a continual breakdown of collagen fibers that support your gums, and even connective tissue support could be lost. The body goes into what we would call overdrive to remedy the situation. It sends floods and floods of these inflammatory cells, which are even willing to destroy your own body to get to the site of the infection. So much so that alveolar bone and periodontal ligaments that support and surround the teeth will be completely destroyed. This is an irreversible destruction. And if you notice our pictures here on our slide, you can see how that jawbone or alveolar bone in the x-ray has dwindled down from the normal levels. Even the gums themselves have started to recede, and those two teeth are more than likely very mobile. So what would be some signs and symptoms of periodontitis? Well, there would be swelling, redness of the gums, bleeding gums, pus, moderate to heavy deposits of plaque and tartar. But two major things that are seen in periodontitis and not gingivitis would be bone loss and mobile teeth. So after reviewing the severity of periodontitis, no doubt a question now arises. If periodontitis is so detrimental, what is the relationship between periodontitis and diabetics? Well, diabetes has become a confirmed risk factor for periodontitis. Diabetic individuals tend to show a greater severity of periodontitis compared to non-diabetics. However, diabetics that do not have their diabetes under control are of great concern, since they are 3 times more likely to develop periodontitis. So what causes such an increased risk for diabetics to develop periodontitis? Well, to start, diabetics have a defective neutrophil function. The defective function of neutrophils, which are key immune system cells, make a diabetic more susceptible to infection. Second, diabetics have an accelerated and exaggerated gum inflammation, which is not necessarily due to the amount of bacteria in the mouth, but rather to how the body responds to it. How the immune system responds to bacteria is what primarily drives the intensity of destruction seen in diabetics. Third, the net loss of alveolar bone could be caused by the prolonged activity of normal bone-destroying cells without the usual falling of bone formation. This imbalance of bone destruction without the reformation of it could cause the advanced damage of bone that we see in diabetics. These 3 things are only a part of the relationship between periodontitis and diabetics. Studies are still continuing to be conducted to have a clearer understanding of what this relationship truly is. However, a good rule of thumb to remember is that any systemic disease in the body can have an effect on the oral cavity in one way or another. Thankfully, periodontitis doesn't have to be the end result for diabetics. Just like with non-diabetics, good daily oral hygiene can help preserve the teeth. A little later in our video, Lorena and Shelby are both going to discuss different areas of good oral hygiene. But now, let's turn our attention to Lorena as she discusses tooth decay and oral fungal infections.
Hello everyone, my name is Lorena, and today I will be talking about other dental problems associated with diabetes. So dental caries. What are dental caries? Dental caries are the result of interaction of bacteria with fermentable carbohydrates on the teeth over time. This combination produces acids that attack tooth enamel. So in other words, when you eat food containing sugar, the bacteria in your mouth use that sugar to produce acids that eat away at your teeth. Now, uncontrolled diabetes increases the risk of dental caries. This mainly occurs through decreased salivary flow, which means less saliva than normal. Any change in the glucose level in saliva probably contributes little to the higher caries rate. High blood sugar levels leads to the increase of glucose in the saliva. Increase of glucose in the saliva increases the risk of dental caries in the patient. Another condition is known as oral candidiasis or oral thrush. This condition is caused by Candida fungus, also known as yeast. Candida is present in the mouth in small amounts, but when the growth becomes out of control, the thrush develops or the fungal infection develops. And this may occur due to side effects of antibiotics, dry mouth, or may also be due to diabetes. The signs and symptoms of candidiasis are white, creamy, or yellow-white lesions or patches. The spots are usually on the tongue, cheeks, roof of the mouth, but may spread down into the throat. They might be uncomfortable, but they're usually not painful. And here we have two examples. The treatment for this condition, your doctor might prescribe you an antifungal, and there's also mouthwashes that can help with this condition. Now, moving on to flossing instructions. Brushing alone can only clean the front and back surfaces of the teeth. The side surfaces in between the teeth and the underlying gum tissue is cleaned using floss. So I'm going to give you a little lesson on how to use dental floss. And for that, we're going to watch a video where I demonstrate how to properly floss.
A long piece of floss, you want to use a short piece because you can control it much better. Next, use your thumb and index fingers to guide about 1 inch of floss between each tooth. Gently slide the floss and then curve into a C shape around one side of the tooth and then the other, allowing the floss to gently slide underneath the gum tissue. Continue sliding the floss up and down and around each tooth. Repeat until all teeth on the upper and lower jaw are completed. But don't let the floss snap down, because if you do that, you're gonna hurt your gums. Go 5 or 6 times up and down the side of each tooth and move the floss along so you're not using the same contaminated worn piece of floss in each area.
So as you could see, flossing is very simple and very easy. But the good thing about that is that you can also use different ways of flossing. One of them is a water flosser. Another one would be a dental floss pick. The good thing about a dental floss pick is that you don't need to wrap it in your fingers. It already has a holder, so it might make it easier for you. And you can use whichever one you feel most comfortable with. The important thing is that you floss every day before you go to bed. And that is it for me. Now we're going to turn our attention to my friend Shelby.
Thanks, Lorena. Hey everyone, my name is Shelby and I'm going to be talking to you about how your medications can affect your oral cavity. So one condition that some of your medications may cause is called xerostomia. What xerostomia is a condition in which the salivary glands in your mouth do not make enough saliva to keep your mouth wet. And this is often one of the #1 side effects of your medications. Some symptoms that you can look for of xerostomia are dryness or a feeling of stickiness in your mouth, saliva that seems thick and stringy, bad breath, difficulty chewing, speaking, or swallowing, dry or sore throat, dry or grooved tongue, a changed sense of taste, problems wearing your dentures. You may be wondering, what's the big deal? Why is saliva so important, and why does it matter if I have dry mouth? So there's a lot of benefits when it comes to adequate amount of saliva in your mouth. And some of those is that it helps to prevent tooth decay, neutralizing acids produced by bacteria. And as Lorena had explained earlier, acids create cavities in your mouth. It also helps to prevent demineralization, tooth sensitivity, and oral infections. It limits bacterial growth. It washes away food particles. It enhances your ability to taste. It makes it easier to chew and swallow, and the enzymes in your saliva aid in digestion. There are a few different options when it comes to treatment for xerostomia. There are a couple over-the-counter medications that you can get at your local drugstore. The first one that you see on your screen is the Biotene Oral Balance Moisturizing Gel. This is ideal for long-lasting relief from dry mouth symptoms. How you use this is you put a 1/2 inch length of the gel on your tongue, and then you spread that thoroughly inside your mouth. The second one that you see is the Biotene Dry Mouth Oral Rinse. It provides immediate relief from your dry mouth symptoms. How you use this is you swish it in your mouth for 30 seconds and then you spit it out. And you can use this up to 5 times a day. And the bottom one that you see is the Act Dry Mouth Lozenges. They soothe dry mouth, moisturize mouth tissue, and freshen breath. They're perfect for on the go, so you can put them in your car. They also contain xylitol, which is really good because that helps in reducing the adhesion of bacteria to your teeth. And it also aids in the reduction of acid production. Your doctor can also prescribe a prescription, something such as pilocarpine. You can get fluoride trays made at your dentist. If you're a gum chewer, just make sure that you choose sugar-free gum. You always want to brush your teeth twice a day with a fluoridated toothpaste and then drink plenty of water. So lastly, I want to go over how to properly brush. In my experience with some of my patients, they do a good job brushing twice a day usually, but they don't always angle their brush correctly, which is going to leave plaque and tartar buildup along your gum line. And when that sits there over time, it can cause detrimental effects. So I put together a little video for you that's going to just show you exactly how to brush. Hey guys, okay, so I just wanted to go over a couple of brushing tips and techniques with you. So first of all, we always want to encourage you to use fluoride toothpaste. Fluoride is awesome. It has so many benefits. Just a couple of them is that it helps to prevent cavities. It helps in the demineralization process of your teeth if you have a cavity, and it also aids in the remineralization process. So it's super awesome. Always check the box and just make sure that it does contain fluoride. So when you select your toothbrush, always go for a soft bristle toothbrush. There's never any need for anything harder. What you're taking off with your brush is soft, so you don't need a hard bristle toothbrush. All that's going to do is wear at the structure of your actual tooth. So grab a soft bristle toothbrush, add like an inch, just one strip of toothpaste. You don't need a ton. And what you're going to do is you're going to take that toothpaste and you're just going to rub it all on your teeth just to kind of dispense it evenly. So what we call this the Bass method. So you're going to start at the very, very back and you're going to angle this toothbrush in between the gums and the teeth. A lot of the times I see people just put it flat onto the teeth and they're brushing like that. You have to brush in between and get those bristles up under your gums. So you want to angle it 45-degree angle right at where your gums meet your teeth. You're going to do little small circular motions over every single tooth all the way across, and you're still angling it the whole time up towards your gums. Okay, and you're going to come across to the other side, same thing, small circles. You're going to do the surfaces that you chew, all of these surfaces, same thing, small little circles. And then you have to brush behind your teeth. A lot of people don't know that, they don't understand it. You have to brush behind there. Bacteria gets there, tartar forms there. You just have to brush behind there, and it's the same concept, okay? Little small circles. When you get to the front, depending what kind of brush you have, if it's a one that's shaped like this, a lot of the times it's easier if you do a swooping motion. So when you get to the front, you can flick it like that. And then of course you want to drop to the bottom and you do the exact same thing. You want to brush in the morning, you want to brush at night. The most important time is at night. You have to get all of that food, all of that bacteria that's accumulating along your gum line. You want to get it off. A lot of the times people don't understand that it's not just plaque, it's not just tartar that's just sitting there doing nothing. It has active bacteria in it that is just causing damage, like major damage. It's making your gums swell, which lets the bacteria go down into your gums, and then it wreaks havoc in there, and it can absorb your bone. Your gums recede. When you have no bone, you have no structure for your teeth to hold in there, so then they come out. So just remember, Twice a day for 2 minutes, use fluoride toothpaste and little circular motions all the way around on every surface of the tooth. Thanks.
Okay, so today we have discussed what periodontitis is along with its signs and symptoms, the relationship between diabetes and periodontitis, dental caries in diabetics, the common fungal infections, the effects of xerostomia, how to effectively brush, and how to effectively floss.
And we wanted to just encourage you to come visit us at Del Mar's Dental Hygiene Clinic. We offer completely free dental visits. They include cleanings, examinations, assessments, periodontal assessments. We educate you in anything that you may be lacking in, oral cancer screenings, x-rays, fluoride treatments, and sealants. And if you want to make an appointment, you can just call the number at the bottom of your screen, and we'll set you up with one of our students. And we just wanted to thank you so much for taking time out of your day to listen to us. We hope you learned a lot. Don't forget to brush and floss, and we hope you have a great day. Thanks.
Thank you.